All right, I feel like we're close enough. Let's go ahead and start off with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Morning, everyone. Monday, July 7th. Good to see everybody still here with all their fingers and everything after the 4th of July. We are having a modified meeting today. We'll be doing budget hearings all day long. And so buckle your seatbelts. It's going to be a really wild ride. I'm Aaron Mays, by the way. On my left is Commissioner Rippon, representing District 1. On my right is Commissioner Kevin Cook, representing District 2. Good morning to both of you.
Good morning.
We did have on the agenda the voucher payments, but we're not going to do that today. We're going to put that off until next Monday. So let's dive in because it is going to be a long day. And actually, I would say, instead of doing the standing every hour, maybe we'll just take a 5-minute break every hour or so that allow people to go to the restroom or whatever needs to be done. So let's go ahead and dive in with audit finance. Jennifer looks eager, ready to go.
Good morning, Commissioners. I am going to be presenting for the 4 different categories that I usually do that fall under my budgeting area, and that includes our department. Audit finance is showing a flat budget other than the MSA 1 increases in 2026. So there's really no changes there. Unlike last year, we had a completely flat budget, but this year we have a small increase because luckily we have had staffing carry over from the prior year. So that's been great for us. So there's not really much to say in our department area. We also budget for debt service. And as it stands right now, there is a minimally reduced budget in 2026 for debt service. It's not a huge reduction, but there are some small debt amounts that are falling off. I included our debt schedule going back to 24 and carrying forward to 2029 because, as you'll see here, we have some minimal amounts that fell off from 24 to 25 and even more minimal between 25 and 26, but our large drop-off comes in 2027, and that is where we have a couple of GO bonds that are being paid off in 2026. Additionally, we have a CIA, certificate of participation that is falling off in 2028. Each of those are originally about $2 million worth, or $20 million worth of bond issuance. And so those will be falling off in the next 2 years, not in 2026, but more in 27 and 28. Then going back just a touch. For the coroner's office, we have a 5% increase because the only budget in the coroner's office is our contract. And that was signed back in 2023 to have 5% annual increases. This will be the 3rd and final year of that agreement. Which brings us to the big one, which is our general expenses budget. I went through and just kind of did a deep review of everything that is budgeted in the general expenses. I was able to find about $121,000 in cuts that we could make just for the printing and advertising and postage. We still are getting reimbursed for our revenue neutral rate posting from the state of Kansas, so there's no reason to budget for those whenever we know we're getting the reimbursement. Professional services and fees for services, both were able to take a small deduction. There is a minimal increase of 5% for Questica and eCivis from last year, so that's about $5,000 increase. Our insurance that we moved over to the GE budget last year, Willis Towers, Watson, actually, that isn't even who's doing our insurance anymore. I didn't update that part of the slide. Our new insurance provider has estimated that we will have a 5 to a 9% increase from our 2025 rates. Luckily, we budgeted more than what we were actually charged for 25, so that means there's only a need to put an increase of about $100,000 in our 26 budget for insurance, which, if you have been around over the last several years, that is the smallest increase we have ever had for insurance in our budget, so that is phenomenal. We are working with our insurance provider to see if there are other opportunities for us. We are looking for new strategies for how to get our insurance to be even lower. And so we are continuing to investigate that with them. And then for our transfers out, which we budget, that includes our capital outlay and then our roof and parking lot transfer. I am increasing the cap out, I'm requesting to increase the cap outlay to the 2.5 million. That's where we started our budget out last year. We were able to find some reductions and ended up at about 2.1 million for our capital outlay. And then our roof and parking lots, in order to continue to maintain all of the parking lots and roofs that we do have, we are continuing to need to transfer $250,000 a year into that fund. We're watching it, making sure that job ledger doesn't grow. It is not. As you know, we just replaced the roof on the courthouse out of this fund. So that took a decent chunk out of that fund. I believe, this is my last slide. This is just showing you the request for the 2026 cap outlay for this year. The heavy hitter, as you see, is the elections office. That's something that we knew was coming. We have opportunity to potentially use some revenue or some excess reserves for that, is one of the items that we talked about, to be able to prevent it taking the entire amount of our cap outlay. If we were able to use some excess reserves for that, that would bring our overall request down to approximately what I'm suggesting we put in our cap outlay. So that's really all I have for you. Do you have questions for me?
Questions?
No. You're fully staffed, and
I am fully staffed.
no one's retiring?
Shh, no.
Okay, good. All right.
Can't wait to get to that capital outlay.
It'll be a fun time.
Yeah, all right, thank you. Okay, next up is the BCC.
Good morning, Commissioners. Amanda Monholland with the Commission Office. I'm here to present somewhat of a flat budget. We did have two line items that I will go and discuss, and then also just a little bit on the salaries. So yes, the majority is everything is a flat budget, except for our equipment leasing, which is our copy machine. We did have a little bit slight increase of $381 due to just anticipation on more copying. And then the other line item is for the Civic Plus agenda software, which was a 5% increase from last year. That's taking us up to like $959 more. Then we have a look at our normal with the salaries, just the regular across the board, as everybody else is saying as well. So yeah, so the majority is from salaries, which was like a little over $46,000, and we had a total increase of 7.71 increase from 2025. Do you guys have any questions from me?
Any questions? No? All right, thank you.
Okay.
Okay, next up is the clerk.
Good morning, Commissioners. I want to thank you for the time and the opportunity to present the clerk's proposed 2026 budget. You were provided with the budget a copy of the strategic plan for 2025 through 2023. through 2030 for the clerk's office. We believe that the budget we are presenting to you today allows the clerk's office the ability to remain fiscally responsible while modernizing the office to provide more efficient and effective services to the citizens of Shawnee County. I would like to acknowledge and thank you for the salary increases for our staff. As you see, our county clerk's office has over 169 years of service in our office. We would not be able to serve the citizens of Shawnee County without that knowledge, and the salary increases help ensure that we retain that knowledgeable staff. The proposed budget reflects a total increase of 5.65% across all line items. This does include the personnel pay raises, as well as a transfer out allocation to prepare for potential retirements of tenured staff. Excluding these pay raises and the transfer out, the remaining budget increase is driven by a 30.27% rise in the services line item, which contributes to approximately 0.25% to the overall budget increase. Drilling down on that services line item and explaining that 30.27 increase, we are making a request to increase mileage, travel, and training by $1,000 each. We are asking this to be able to provide staff with the opportunity to build on the skills that they already have, as well as obtain training to support our strategic plan. Recent budgets have reflected that these line items have remained flat over the past several budgets, while inflation has increased. I want to thank you for your consideration of this budget for our office, and I stand for any questions.
Questions? I've got one real quick. So historically speaking, because of the years of experience that our office, our clerk's office has, we've helped out a lot of other counties. When we go to another county to help, do they pay for our mileage and anything like that? Or is this just done as a favor?
I do not believe we have. A lot of times, I know we're helping some of the smaller townships with budgets. They typically come to our office to do that work. I think historically, when Lori has gone to some of the other counties, that's just been out of goodwill and collaboration.
Okay. All right, any other questions? Okay, thank you very much.
Thanks.
All right, we're cooking, guys, so let's,
We're going to stay a long time.
let's go to facilities management. Or, oh, I'm sorry, elections. Elections first. Same guy, though, for part of it.
Good morning, Commissioners. Andrew Howell, Election Commissioner. Just want to talk briefly about our 26 budget request. One of the things I like to highlight when we do get a chance to talk about elections is just that I think there's about 17 or 19 different things that we end up having to manage between federal law related to ADA, and of course security has been a big issue for us over the last few years and will continue to be. A lot of communication with the public and with voters. And then, there are things in the election office that aren't just directly related to each election, just things that we have to do each day and every day, including street file maintenance, voter registration and maintenance, and those laws change pretty regularly. So staying on top of those laws and processes takes quite a bit of time and effort. I think we've given you our strategic plan, so I won't spend a lot of time on that today. But if you have questions, I'll be happy to try to answer them. We did a voter experience survey back in 2023 because I wanted to understand what the public perception of the services that we provide at the election office was. So these three questions, we had an 86% participation rate. I was actually surprised that 90% of the public said that they had a great experience. They understood all of their voting options as it relates to mail, early, and in person on election day. And again, pretty close to 90% on level of confidence in how their ballot is handled. So I think that speaks highly for the job that we're doing, and we'll continue to work on keeping the confidence of the public in the way that we run elections here. The 2026 budget overview, reminder, this is the smaller of the two even years, but typically we find ourselves bouncing back and forth on amounts. So you really, to do a good apples to apples comparison of our budgets, you really have to go back 4 years to find the most recent exactly similar budget. So I think our budget can be a little bit complicated to understand the amounts requested because of that. We are going to have constitutional amendments in 26 in both the primary and the general election. And because of that, we will have to have separate ballots for unaffiliated voters. So there will be a significant increase in our ballot costs in 2026. So that's included in these numbers. We know that we have 2 elections. However, as we always say, there really is always the chance of additional elections that we have to run for either the city or for school districts or for bond questions or other things that may pop up. And typically, per your request in the past, we have not put assumptions as to what that could cost in there because we simply don't know it until it's closer to time. The partisan primaries are the most complicated election that we administer because they require that we have additional ballots, and additionally, it's a precinct by precinct because you have precinct people running on every ballot. They're a lot more complicated and they can be a lot lengthier, and there's multiple sets of ballots for each party. Many of our expenses still remain relatively constant regardless of the size or turnout of the election. So this is just a graph to represent kind of an estimation of the significance. It's not the largest budget, it's not a presidential, but it's right next to it. We call it a governor election because that's typically when a lot of the statewide elections occur, and it's a fairly high turnout election. We have, talking about MSA 1, probably won't spend a lot of time talking about those wages, but just a reminder, 5 staff have completed the certified election officer training. 3 of our managers are nationally accredited certified election registration administrators. We also still have 2 additional staff that are actively pursuing certification or within a year of graduating. Even years, again, require significantly more intermittent staff than odd years. So those numbers are going to look a little bit bigger in even years. There's just simply a lot more mail ballots and registrations and just folks to train for the election as well as to manage in an odd year. Additionally, we're finding our quarter requests and subpoenas and even court time is increasing as we go forward. So I expect that will continue to be the case going forward. It just takes a lot of time to try to find documents and try to anticipate what the next set of requests and court time will include. MSA 2, 3, and 4, and just again a reminder, there are a number of new statutes, rules, and regs that are adding significant complexity and cost to our elections. While they are important, they are not without additional costs, and I think sometimes that can get lost in the translation at the county level. There are new statutory and KAR security requirements for election equipment that have driven up the cost for delivery to our polling places. Our utility rates continue their upward trajectory, although not a big driver of cost and additional cost at the moment for us. Just a note, about $100,000 of our increase is due solely to the additional cost of delivering election equipment to 87 locations as compared to the prior 4 years. So those security regulations and the amount of ways that we have to package equipment and deliver it is just simply costing more. We used to be able to deliver a lot of that equipment individually, and so it was a little easier to roll on trucks, but now we've got carts that are about 650 pounds apiece, so they require a significantly different approach to it. So we're going to see some increases in cost, and a lot of that's driven by those new security requirements at the state level. At the end of 26, we are planning to request replacement of voting equipment, as our current equipment will be approaching the vendor's end of life service expectations. This includes poll books, high-speed tabulators, electronic poll books, and ADA ballot marking devices. Current estimated cost of about $3.1 million. And then the thing that's complicating timing and decision-making on this a little bit, so we're probably going to be doing some very deep research work over the next year or two. VVSG 2.0 and 2.1 actions by the EAC may add some costs and complexities to our current plans. Again, this is developed over the last 2 or 3 months, and I expect to know a little bit more, somewhere hopefully between September and December, have a better idea of how that's going to land, what it's going to look like, how it affects poll books, and how it affects, probably the biggest single issue is our ADA equipment for voters. So I hope to have a little more clarity over this. Again, we're still sticking to our timeline, but it probably will require some fairly deep digging, much like we did in 2015, because we were one of the first counties in the state to acquire some of the newer equipment at that point in time, and we didn't want to make a mistake, so it took a lot of pretty deep digging to get that figured out. Here are our numbers for MSA 1, 2, 3, and 4. Again, they're very much in line with what you've seen from us in the past. Happy to answer any questions.
Any questions?
Yes, Chairman. This polling equipment, is something you have to just change throughout all your
It is.
precincts?
What we find is that the versions have to match, have to be certified. Poll books themselves are having to change, and you really want to get as many of those different systems matched up as you can. I am planning on doing a little deeper dive to see what additional options are in the marketplace, and I think there's an interesting option or two, but I simply just don't know enough about it to know if we can actually use it or if it's a significant option. But I do think this calls for a deep dive on trying to figure out the full extent of all options related to that.
Any other questions? No? All right. Thank you, Andrew.
Thank you.
Okay, now we'll move on to facilities.
Good morning, Jake Fisher, Interim Facilities Director. We've presented our budget. We're looking at approximately a 2.3% increase, the lion's share of which would fall under the MSA 1 category, salaries, step-ups, such as that. It's pretty straightforward, but I would stand for any questions.
Any questions? No? Okay. Yeah, pretty straightforward budget there, so thank you very much.
Thank you.
All right, human resources.
Good morning, Commissioners. Angela Lewis, Director of Human Resources. I'd like to say that mine is flat, but it is not. I'm actually asking for something beyond just our regular MSA 1 increase. Our budget request for this year is $776,778.48. The majority of that is personnel cost at 82%. Supplies are actually at 1.5%. Basically, leases are at less than 1%, and services are at 15%. This year, our big ask are for a comprehensive wage study at $100,000. This would cover all positions. We're asking for a contractual service increase of $100 to cover ACA mailings, and equipment leases of $100 increase to cover our copier contract. We last did a comprehensive wage study in 2021, and it was implemented in 2022, the $100,000, and that is a max cost. We've done some initial estimations with some different groups, but of course we have to go out for RFP. $100,000 is a max that we feel like we'd be willing to pay. Anything that wasn't spent in the study could easily be moved to cover cost of salary increases for employees. Your question to me, I'm trying to anticipate, would probably be, why do we need this wage study? We need to be able to stay competitive. We have seen some fairly large increases for unions and command staff. We need to make sure we're taking care of all of our employees comprehensively. That will allow us to not only retain, but to recruit new employees to the county. I'd be happy to answer any questions you may have.
Any questions? All right.
Thank you.
Thank you. Okay, Mark.
Morning, Mark Price, Information Technology. I'm here to present my budget, and sadly, I'm definitely not flat. Why we did have a significant increase when it came to salaries. We've also had some in our contractual services. So from last year to this year, my actual overall increase request is $826,053. Like I say, there's probably almost a little less than half is from salaries. The majority of that's in my classified area. Currently, we have 24 positions. We do have 2 vacants. One, we are having someone who will be starting July 30th of this year. The other position, we're actively doing the interviews of applicants and hoping to be able to find someone soon. We're kind of having a struggle finding a qualified candidate that is going to be able to step into the position and do everything we're needing. So we are evaluating that position, trying to figure out how we get it filled, because it is a very key position, being our chief network engineer. It's almost a right hand to me on the support of all the desktops and networking equipment throughout the county. The actual largest place where my budget's increasing is in MSA 2. We have a small increase in repairs and servicing, which majority is coming from telecom support. We just have aging handsets those are the phones on the desk that we're having to go through and make sure we have them up to date and replaced. We're just seeing those, I think, are coming up on 8 to 10 years, and we're having to go through and have more of those on hand to replace, and that's where that increase is coming from. The majority of my increase is here in contractual services. The probably biggest change from where we've been in years past is Microsoft has moved really away from where you can go out and buy an Office license and keep it for 10 years, and then 10 years later go buy another license. They're getting to where those, if you go and buy the license, where it becomes end of life is getting very small. So we have decided to move, instead of the perpetual licensing, which used to be more cost effective, to a annual subscription based is what is being reflected here. That is about a $474,000 increase to our, $269,000 increase to that line item. Other increases consist of the addition of our archive social next request, and some ADA compliance software we're getting from Civics Plus. There was also a addition of this actually might not be the right place for it, but we added $30,000 for security camera and security system maintenance. That is something that had not been budgeted anywhere, and over the last few years we've kind of found a struggle as people are wanting to make additions or items are failing, coming up with the money to pay for those support and changes to the system. Another large place in contractual services is this would be a 1 year at this amount, but it was a $95,000 increase for a content management system for our web. It's been one thing we've had multiple departments ask about. This would give departments more of a ability to self-serve stuff onto the web, not always have to wait for IT. And when I say wait for IT, you'll have the sheriff's office, elections office, DA's office have the stuff happen overnight, evenings and weekends, where they want to be able to post information and get it out to the public quickly. This would give them that ability to do that. It also would, I believe, help solidify our ADA accessibility on our main website is another big reason. The $95,000 would be the implementation cost. The second year cost after that and continual support would be a lower cost after that fact. We also had minor increases in our travel and accommodations and training, which did go over the threshold of 3%, but those overall were pretty minor increases. Sadly, it's not a huge deal, but we did have a decrease in our membership dues and subscriptions of $1,500. Then we go to my MSA 3, which had some minor increases. the majority was our tech refresh. We've just seen over the last year the cost of computers going up, and to be able to keep our replacement of items going in a timely manner, I felt it was prudent to increase that to be able to allow us to buy a few more systems than in years past. And then again, we had a small increase to our miscellaneous, which when you ask what miscellaneous is, because it's really a great descriptor, it's kind of the minor technology items that we're buying. It comes down to repairing of printers, it's buying of batteries for UPSs, so we don't have to buy all new UPSs. And we're just seeing those consumable costs go up. Other things, it's when we're having to do wiring and install of cabling to new locations or maintaining of cabling in locations, those expenses we have for that is what that miscellaneous is. And I say that was a $3,500 increase to miscellaneous. Then kind of the final piece of my main budget is my capital assets, which is our new TANIC system. I did not ask for an increase there. I think where we're at is sustainable for the next few years and shouldn't need to increase. Then I have two capital improvement projects. One is, I hate to say it's kind of become a regular item every couple of years, but it's replacement of our network switches. We do have a main switch stack that's coming up for end of life and will need to be replaced in the next few years, and it just keeps us going to where we can keep our equipment up to date and replaced with newer technology to meet the growing needs of the county. Then the final CIP item I had is a county building fiber. This is something I've talked with Kurt Niehaus about. This fiber would go to the North Community Center area. I call it North Community Center, but really it's North Community Center. It is Public Works, it's household hazardous waste. There's the sheriff has a facility up there. Parks and Rec has multiple facilities up there at 46th and Topeka Boulevard. Over the past few years, as things have increased on the internet and they're doing more work up there, there has been a complaint about the current connection we have. This would allow us to put in our own fiber and provide the workers and the people using the community center with a faster connection. This would be done in conjunction with the Rochester Road project and realistically utilize a lot of the road work they're already doing to get the conduit installed, which is one of the biggest expenses to doing a fiber project. But that I have as a 27, 28, 29 to get that installed and prepared. And with that, I can answer any questions you have.
Any questions?
What is the connectivity right now at North 46th Street, the solid waste, the Public Works, the Parks and Recreation?
So currently we're on a Cox Metro E connection, which is a 10 megabyte connection, and that is serving the community center, the pool, the sheriff's location. The Parks and Rec has a maintenance building up there. There is a road and bridge shop, there's a sign shop, there's the household hazardous waste facility. I would probably estimate there's probably 30 different workstations up there. So, and I would gander most people, if you're really cheap like I am actually at home, I'm only getting 500 megabytes at home. And so they're working off a 10 megabyte connection up there, which is significantly less than most people would even have at home.
So do we even have the ability to host a Wi-Fi connection at the pool presently?
We don't have an ability. We do have a Wi-Fi in the community center for the public labs, and that is actually on, it's a secondary Cox circuit that's independent of what we're running the county traffic over. With a fiber like this, we would be able to host that all as one off of our main connection we have back here at the courthouse, which would be a faster, more sustainable connection. And I do actually hear when summer hits from the pool manager up there on a daily basis. That is my daughter, and she does complain about the connectivity with the phones up there. And one, it does become kind of a safety issue. Why they do have hardwired phones, but sometimes when they're out there if they're having to be on the deck with a cell phone, there's not always great connectivity. They do use their phones for monitoring weather while the managers are out moving around the facilities, and that's not always something that's good and reliable if you're outside the guard, if you're not on a computer for the county. And I don't know why she paid you to say that, because she's, like they've been asking me for about the past 3 years what it takes to get Wi-Fi up there.
She's not the only one.
So you're saying not only is there not a strong Wi-Fi, but there's no data or like cell data either?
There is cell data, it's just the location is not as reliable as some areas. There's actually zero Wi-Fi at the pool itself, I will say that. There's none.
Right. So they don't have the ability to run credit cards at all then, or?
No, there is a fiber that goes from the community center to the pool house where the manager's office and the offices are. But when it gets down to, like I say, they use their phones for lightning alerts, they use their phones for watching weather. They do have the computers, but if they're trying to be out on the deck, they've got to have someone leave the deck to go back and watch that data.
Okay. Any other questions?
No.
All right, thank you.
Thank you.
All right, next up is the treasurer's office.
Good morning. Susan Duffy, Shawnee County Treasurer. I want to give a shout out to IT. I know all of us in the back, we're going here, here. IT is the hub of everything that we do now. And having a robust system is essential to our being able to do our jobs. More importantly, the ability for IT to respond when there is an issue. They come over. They come over quickly, they fix the problem. I appreciate all that they do, and I know it's extremely important to all that we do. So here to IT. The Shawnee County Treasurer's Office provides the services for the Treasury and Vehicle Departments. The Treasury Department bills and collects real estate and personal property taxes. The funds are then distributed to local taxing authorities. The county treasurer also serves as the agent for the state of Kansas in the titling, registering, and renewing of vehicles in Shawnee County. Funding for the vehicles department is from fees collected, and oversight is through the state of Kansas. So although we offer this service, and this is how most people know us, the budget is not included in our treasury budget because it comes from the state of Kansas. We receive that quarter from each transaction that is performed. So that is a completely separate function. What I'm talking about today is the Treasury Department. Our mission is to provide efficient and courteous service to all Shawnee County citizens in the billing, payment, and crediting of their personal property and real estate taxes, to ensure that all aspects of collections, payments, and distribution of funds are accurate and timely by working collaboratively with other county governmental entities. And I would have to say, my first few months here, I realize we are so closely connected with very many departments: audit, finance, the clerk's office, the register of deeds. We're all connected, and I appreciate their assistance and their help. Our budget for FY 2026 represents a 2.66% increase. This increase is due to the proposed increase in salary-related costs for the 8 FTE as provided by fiscal. The other operating expenses for the treasurer's office remain flat, but I have switched between the object codes to provide more training. As Shawnee County does not provide training for managers, I will be taking advantage of the programs offered by the state of Kansas for manager-related training, and have shifted funds because one, the new assistant treasurer, she is new to the position, and this is a training I believe will be very valuable for her. That is it, unless you have questions.
Any questions? No? All right, thank you. Okay, next up is our county counselor. Welcome to the microphone, Rich.
Orange and yellow, great colors.
You have 40 minutes.
I'll
Yes.
take all of it, please.
Yeah.
I need 10 minutes. Good morning, Commissioners. Rich Eckert, County Counselor.
50 minutes.
I would like to Jake Fisher treatment where I say, do you have any questions? And then I sit down. Just a couple of facts. What we're asking for is an entire budget for my office of $860,000, basically. On this page, you'll notice that salaries is $807,000 of that, which means that my budget is pretty much 94% salary. All the numbers have moved just a little bit. But then the tax sale fund, I do want to talk just a bit about tax sale because it seems to be an incredibly popular topic since I've gotten here. The first tax sale that I was in charge of, I raised the fee that we assess to each property dramatically. And I raised it so dramatically, Judge Watson called me in and made me justify it to her, which I did. So our fees are now court-approved, if that means anything. Well, it means a lot, actually. And last year, those court fees brought in $120,000. So when you look at my tax sale fund, and I'm asking for 60 or 100,000, know that all you're doing is loaning me some money. You're going to get it all back, plus another anywhere from $20,000 to $50,000. So the other thing that we did, because in 2025, you can see the salary allocations to perform tax sales, those are really low. So the 2026 assessments more accurately reflect what we do. And if anything, Cheyenne's and my time might still be low, but that seems to be a good place to start. So if you have any questions, Jake Fisher will answer them.
Any questions for Rich?
No.
No? Okay. Thank you very much. Okay, so we are way ahead of schedule, surprisingly so. Let's take a little bit of a break. I know Susie is working diligently to see if we can get anyone to come in early from maybe our afternoon session. So I know that at least one person said they were going to try and make it in here soon. So let's take a little bit of a break, just kind of stand at ease for a minute until we have a better sense of what's going to happen next. Okay, it is 10:15, still running ahead of schedule, but not by quite as much as earlier. So we will go ahead and get started with our second group today, and we will begin with the Health Department. Teresa, welcome.
Morning, Commissioners. Morning, everyone. I am Teresa Fisher. I'm the Director of the Health Department, and I just want to say thank you for the opportunity to present our 26 budget. The budget that we're going to present today is crafted in part largely by some of the division managers that are with me today. I've got Kathleen Burrows, who oversees finance and admin, Carrie Dels, who's over our clinical services, and Amanda Neosi, who's our accountant. But really, it's all of our team leads, it's all of our program leads, it's everybody coming together and constantly looking at what our line items are, what the programs might be needing currently or looking ahead to next year. So there's a lot of people that are not in the audience today that helped work on this budget. This slide that we chose to open up with has our mission statement, and I just thought I'd take just a minute to pause. If you haven't ever read our mission statement, this is really what we're about. And so we start every all-staff meeting by reading our mission statement. We start our supervisor meetings by reading this. We start a lot of our even just small team meetings by reading this. It really gets everybody in the frame of mind, the mindset of what we're coming together to do to accomplish, not only during that meeting, but this solidifies the work that we're doing here in our community. And it's the team that does this day in and day out. And this really does embody the work that we do. I always like to do a fun meet the team. These are the people behind the scenes. This is our most recent picture of our team. We currently have 67 FTEs across all of our programs, and I'm happy to report that we are currently only actively recruiting for 5 positions, and of those 5, 2 hopefully will be job offered soon, and we only have 1 nurse opening. So it's been a long time since I've been able to say that. But this is our Workforce Development Day that you graciously let us have close our offices, and we got to get together for some training and some team building. But these are the true heroes of the health department. Here is our budget request. So we are asking overall for a 3.4% increase. That total amount is there at just under $111,000. This includes both our salaries and our benefits. Those actually came in at about a 6% increase for the year. However, our operating expenses actually decreased by about 3%. And again, it's that team constantly sitting and looking at line items and what we can do to improve operational efficiencies in all of the programs. So we're going to take a little bit deeper dive as we move through. I do have a few slides today. Things that I want to note is this is not our only budget season. So for us, we have a lot of grants and a lot of programs that work in our state fiscal year. So that literally just ended, and so over the course of the next month, we'll be wrapping up a lot of those. So they're really at the end of that cycle. The new state year just started last Tuesday. We also have programs that work in the federal fiscal year. So they are just starting the last quarter, and we'll be navigating the last quarter and closing out that. And then our county fiscal year. So my team is very used to looking at budgets year round, and that's what they do because none of these line up perfectly. They never have, they never will. We're constantly looking at what fits into what and making sure that everybody stays in line with all of the budgeting needs. The other item that I want to talk about before we move too much further is our aid to local grants. So our aid to local grants, typically we have received or know what we're receiving by this time of budget presentation. However, this year is a little bit different. We have not received a multitude of our aid to local state grant awards. Some of them we have only received partial funding of, some we've received no funding of. And so when we built this budget and submitted it, it was with the notion we had forged ahead just like we have every other year, and we built it based on what we had received the previous state fiscal year. So that's what this budget is built on. However, truly, our financial picture could look vastly different depending on what happens with our aid to local grants and as they come in or they don't. I do not have a slide for our CIP items. Our CIP items fell under facilities, and so we really have just one for 26, and that's the flooring at JP Lewis. That flooring is, I think, getting close to 20 years old. It's really reached its end of life. It's degrading in parts, and it's to the point where it's not repairable. I know they had looked into seeing what patchwork could be done, So that item is on the CIP list under facilities for next year. We looked at everything of expenses over 3%, and I know all the notes are put into Questica for you to read. These 5 line items are 3% up to 15% increases. Their percent is listed there as well as the dollar amount. I will talk about professional services and equipment leases here in just a moment. I'll point out with computer software, this was an increase due. We had a small electronic health record connectivity grant that we have been able to use over the past couple years to cover a lot of our electronic health record cost. Those are per user, and so some additional cost has rolled into the departmental budget on that. These expenses are 15% or more over. Again, the percent is listed and the dollar amount. I'll go through some of these with you. For the telephone, this is an increase due to a software that KDHE uses. It requires a multi-factor authentication. We're well aware of that here in the county, and we know what that's about. And so there is no workaround for KDHE except through the use of a cell phone. So staff that typically don't have cell phones have had to have cell phones put into place so that they can access this program in order to carry out their job duties. The other piece, I'll talk about contractual services here in just a minute. Memberships has increased. This is due to Adobe Pro, and I know Mark spoke some about the licenses versus subscriptions. So we have a multitude of staff that need Adobe Pro, again, to do their job functions. And this used to be a one-time license fee, and it's moved to an annual subscription. So that has been an increase for us. And then the last one, although it's a small dollar amount, the building maintenance service and repairs, it looks large at 103%. This is actually due to the change in vendor for our mats. We have mats at both JP Lewis and 10th Street. And so we've reduced the number of frequency that we get them at JP, but this is still the additional dollar amount it's going to cost for our new vendor with the mat company. All right, our 3 largest dollar increases lie within these 3 areas, and I'll break them down just a little bit more for you. Professional services, this is a 4% increase at $3,900, and this is due to our doctor that we have on contract who oversees our TB patients in all of our cases. And so this is just due to an increase in some grant allocation. Typically his contract runs the same each year in the dollar amount, but we honestly don't negotiate those till closer towards the fall. But this is just due to a change in some grant allocation, and so a portion of his at $3,900 needed to be reallocated and moved into the departmental budget. Our contractual services, this is an increase of 22% at just under 11.5. The reason for this is due to our early childhood block grant that our Nurse Family Partnership Program receives. Historically, that grant has required a cash match at different times, and while they haven't for the past several years, they are requiring it for this current grant year. And so the finance team looked, and this is a portion of what we pay to actually be an implementation site for Nurse Family Partnership. That allows us to basically use the name, the forms, the database, everything that comes with it. But this is a portion of that fee that we needed to put into our departmental budget in order to satisfy that cash match requirement for the early childhood block grant, which in turn then also allows us to draw down the OPEI dollars from KDHE. Our other item of increase is equipment leases, and so this is a 6% increase at just over $3,200, and largely this is due to an increase in the copier machine contract. Those copiers, most easily said, are just more expensive than what we were at, and so we have a multitude of copiers across our 3 locations, and so that is the bulk of what makes up that, but we also have 5 health department vehicles that will be at the end of their lease next year. And so we have done some preliminary quotes, and we have budgeted for an increase based over what we're currently paying, because we know just the price increases for those. And then revenue, I wanted to include this. We are one of the departments that has fees for services, and we have fees for services in a variety of our areas. We have them in our clinical services, we have some in our family health services, and then our 2 regulatory programs also. So this is looking at where we're at year to date right now. Last year, when I came before you for our budget presentation, we had projected our total at that point to be about $778,000. We actually ended the year around $784,000. And I want to say that was just in large part due to our great billing team and really getting us caught up. We have had some changeover in staff, and when there's changeover in staff, there's always a delay in billing. And so they've done a fabulous job getting us caught up, and this year they're doing a really good job at just keeping us up to date and doing the timely billing that's needed for all these programs. We are a little under budget this year, and so we do know that immunizations is our largest revenue source, and we know that we haven't hit their busy seasons yet, usually back to school and respiratory. With that said, we've recommended a 3% revenue increase for next year. However, it's worthy to note that there's a lot of variables that play into that, and the immunizations department is one of those. So that concludes our presentation today. My team and I are happy to answer any questions or provide additional information.
Questions?
Sure. So I know a lot of this is unknown as it's newly developing or quickly developing. With the state cutting grants, changing grants, not knowing what we're going to get, are you going to need to have contingency funding? What are we going to do to keep programs? Are we cutting programs? Are we cutting staff? What's the plan?
Yeah. As I said, for the state fiscal year, we've just started. And so we are literally 1 week into it. And I think right now, we are trying to let the state play out. We've been told that more information to come, and so we're kind of in this standby mode right now, I would say, for some of those programs. Some of our funds have come through at what we expected. So our immunization action plan is one of those that we haven't received funding yet, and we're not sure that we will. So I would say within probably this first quarter, we'll be looking largely at where we're at. And our immunizations department is already very lean. We already have very few staff. We've cut some positions over the years and combined some. So I'm not sure that we can do without any more without pulling supervisors into doing that. So I would say in the early stages right now for the state fiscal year grants, we're in a wait and see to see probably this first quarter to see where the state lands based on that. Literally the information is coming through to us sometimes day by day, sometimes multiple times within the day.
So here's the thing. We need to know within the next 3 to 4 weeks so that we can budget. And if we don't budget, you're going to have to draw from contingency. And as you know, contingency goes very quickly.
Correct.
And otherwise, we're going to look at cutting programs in Shawnee County.
Correct.
I mean, I just don't see another alternative. Either we budget for it, we plan on contingency, or we cut. And so.
And as I said, when we built this, we had no reason to believe anything would be any different. And so right now, our WIC program is our federal year, and so that one's a little bit of a different story. I think we will be better set to know for the next federal fiscal year based on that. We know there's lots of changes happening with that. Yes, we've reached out to the grant managers for these programs. I would say we'll reach out again this week and say, do you have any other updates for us? Every local health department around Kansas is in the same shoes as that we are right now, and it's a very tough place to be, not knowing what's coming or not, and knowing that county budgets are being set.
Right.
So yes, I'm looking to audit. We may need to come back and readjust what our ask is. Some of these programs historically have been largely grant funded, and we did not build them in at that time.
And like I said, I know that that's not your fault. I mean, you put together this budget months ago. This is information that's really within the last even 24 hours. It's a continuing, outside of your control with the Kansas Department of Health and Environment, the state of Kansas, the federal government. So there's a lot of people upstream from you that are impacting.
Correct.
But I'm looking back down at the end of the line to our audit finance to when we have to get our budget set, and realistically, we've only got about 3 to 4 weeks before we need to be able to lock in for public hearings and for everything else.
Our due date for setting our resolution and notification to the county clerk is 1 week from today.
All right, so you've got 1 week.
Okay. My finance team is here,
Yep.
so.
Because the way that the meetings fall this year, it's due by the 20th, but the 14th would be the last meeting day that you guys have prior to that.
All right. So I think we'll go back, we'll ask the state if there is any other information that they can share with us today, and we'll go back to the drawing board to see what we may need to ask for.
Like I said, I know it puts you guys in a very tight position, but again, with the schedule and everything else that we have and statutory requirements to notice to the public, we have our own requirements.
Absolutely.
So,
It certainly seems like the intent is to push the state's cost off onto us. And I don't think that we're going to be in a position to raise taxes to cover their budget. And that is not a spot I want to be. And so, I mean, it's a tough place right now. And I don't know why, but they seem to focus on the health departments. I mean, so, it's not your fault, I get it. It's frustrating, though.
I think that's the spot that we see it the most. We're also seeing it in emergency management. It's just the health department and emergency management are the two areas that get the most pass-through grants from, federal grants from the state. And then, like I think I talked about this the last meeting we had. Additional to the federal cuts, the state did a 1.5% cut across the board. So those are all passing along to us.
Yeah. Commissioner Rickland, anything?
You guys have asked all the questions I was going to ask, so.
Okay. All right, thank you. All right, next up, we'll move on to the animal shelter. Welcome.
Catherine Maxwell with Helping Hands Humane Society. For 2026, the shelter is requesting $151,806 and court hold fees for a projected intake of 1,096 animals from the county. That figure comes from the average of in 2023, 1,064 animals were brought in from the county. And in 2024, there were 1,128. So we average that out to 1,096 projected intake. County, for the court hold fees, they'll remain the same as they did this year. In 2024, the county only brought in 8 animals that were on court hold. So far this year, it's only been 2, so I don't project or anticipate a large number of animals coming in on court hold. Typically, for the past 10 years prior to 2023, the county never had animals on court hold. So this has just been a fairly recent situation. But again, it has not historically ever been a large number. But ultimately, I mean, it kind of is what it is. We obviously don't want stray and unwanted animals running around the county. It is a safety and a health risk. So the shelter is happy to continue to take in those animals and continue the relationship with the county and support the safety of the county. So I'm happy to answer any questions that you have.
Okay, any questions? All right, thank you.
Thank you.
Okay, next up, CRC.
Sorry, guys. Long time legal stuff, huh?
Good morning, Commission. Mary Thomas with Community Resources Council. I think the paper, in my mind, is easier only because when you start drilling in on these spreadsheets, the numbers are a little small because there's a lot of information for you. So for me, it's easier, old eyeballs. So I tried to look at it from your point of view, not that you're as old as I am. The letters are pretty much the same that we've talked about over the years. We are not looking for any increases in anything as far as managing the process. We told all of the agencies that applied flat budget. Most of them heard me. A few like to take a run at it just in case there's a few extra dollars. The volunteer committees that met for both of these granting opportunities, the Advocacy Council on Aging, which is kind of the larger spot for the money here, which is how it's set out in the, it has been done for previous years, and then the social service, which could be aging funding or just straightforward social service funding. It's about $1 million together for both. You can see that we only have 1% increase from last year's recommended funding and approved funding in '25 for social service funding. Some of that is due to, you see, a few agencies did not apply that applied last year for an assortment of reasons. Typically, they were a one and done. We see them periodically, but not every year looking for grant money. So we had a light year, if you will, for '26 budgeting. And then on the Advocacy Council on Aging for senior social services, they came in at 12%, even though we tried very hard. So the committee, everybody got a little bit of a haircut. The committee went to work trying to figure out who needed what, how they used the money last year, and asked some tough questions to some of those agencies to make sure they felt like the money was being spent how we all thought it was being spent. Budgets change, programs change, and when they have something mid-year, I will hear from them asking for clarification or direction on if they need to swing the money to a different part of a program, or if a program has phased out, if they're doing something different. So I haven't found anything yet that I need to bring to you for clarification. I can usually help them work through what they're doing. And it's been a pretty smooth year, and I submit this for your approval, and happy to stand for any questions.
Any questions?
I do have one.
Yes.
Sorry. I just wanted to clarify. I don't know, the 2025 amount that was awarded, I am showing it was $258,500. And I think you are showing that much higher.
On social services?
Mm-hmm.
That's
So
that's
there
what we
is a
submitted.
sizable increase
There,
there.
sure, well,
Yeah.
I'll have to look, you and I need to get together afterwards, because
Yes,
this
absolutely.
is what the award letters I put out. So I think this is what's been expensed out quarterly.
All right, I was just looking at the resolution, and it says 258.5.
Okay, right. We will talk after all of this concludes.
So that's less of a question about
That's,
26
yeah,
funding.
that's a bit of a hike,
25.
but I just show 301 for 25. Anyway, we'll sort that out and come back to you if it is a bigger hike than what I'm showing at 1%.
Okay. Any questions? No? All right.
I can tell you that we do review these agencies. We go in-house once a year with all of them, make sure that they, the voting members of the council, make sure that they're applying the funds correctly. I mean, they have a lot of other things going on with money besides this funding, but every one of them use it as their cornerstone to go out for match funding. They know times are hard. They have stepped up their fundraising, so they're trying their darndest to do what they need to do to make sure they stay relevant and not come back for more money.
Okay.
Thank you, gentlemen.
Thank you. All right, next up will be health access. Thank you.
Thank you.
Good morning. My name is Megan Skaggs. I'm Executive Director of the Shawnee County Medical Society Health Access Program. We have been in existence since 2002, and since then we have improved access to health care for 18,532 unduplicated low-income uninsured residents of Shawnee County. What we do is we work to combine donated health care with physician care, hospital services, dental care, optometry, and medication assistance in a coordinated program. We're going to kick off before I get into our budget request. I'm going to show you a short video that was put together this year through our LINK program. Sometimes our patients tell their stories much better than I can, and so this particular patient was enrolled in our LINK program. She is now awarded Medicare, and so she was one who we helped for a short time in health access, and here is her story.
Topeka Community Foundation saw the data around health in our community and learned more about the social determinants of health, we were compelled to change our grant making to make the kind of difference that we all wanted to make in our community for our neighbors who need our help the most. We shifted our look from transactional grant making to what we called transformational grant making, and asked our nonprofit partners to look at issues of importance in our community with a broader lens, to look upstream around the health of our community, and to think about things not only as health as it walked into the door, but what was happening at home and how could we have an impact around that. Link came to us with this innovative idea around partnering in a way that had never been tried in our community before. What would it look like if we looked at patients who came to Stormont Vale and assisted them not only inside of our doors, but at home where they needed help the most? And that partnership has created a new system for addressing health in our community. That is what we want to focus on. What are the systems? What are the policies? What can we do in our community to really move the needle around health for our neighbors who need our help the most?
The LINK program starts with a patient from Stormont Vale. That patient from Stormont Vale will be identified as someone who would be eligible for health access. So to be eligible for health access, you must live in Shawnee County. You must live under 150% of the federal poverty guidelines. And if you do not have a primary care provider in Shawnee County, we help get the patient connected with primary care. Once you are identified and enrolled in health access, then we send that patient on over to the Stormont Vale social work team, and the social work team will screen that patient for eligibility for LINK. To qualify for LINK, patients must meet 2 of 3 metrics. They will be homeless, they have a rising risk score for readmission to the hospital, or they are food insecure. So if they meet 2 of those 3 metrics, then they are identified as someone eligible for LINK, and then the social worker will do a warm handoff over to Vallejo, the support navigator, for some intense case management.
The LINK program has paid for my medication on several occasions. My father got ill, I quit my job so I could be a caregiver, and he ended up passing away quite quickly, which threw me into being homeless and struggling on that, living in friends' houses or in my car. Then I fell into addiction, and when I hit rock bottom and it became dangerous to be on the streets or living in my car, I got connected to Vallejo, and they had a good support system, and I had some medical issues that were real prevalent, and they took me to the mobile clinic on 6th Street, Topeka. I won't forget it, and met a very wonderful nurse there that really listened to what my medical issues were, and she made a great observation that it was more serious because my addiction was covering up my pain. And so she made appointments with Stormont Vale, and there the ball got rolling, and we found out it was serious. So there they connected me with health access. So without that, I probably would have lost my life.
When we hear the stories, when we see the impact that this new model of care has had in our community, we can't help but feel compelled to ensure that programs and ideas like this continue to be funded, and that we continue to make the kind of difference that we want to make for those in our community who need our help the most.
So our LINK program is largely funded by the Topeka Community Foundation. They put together this video for us. But what the Shawnee County Commission, what you fund is our prescription program. And
this is democracynow.org, the War and Peace Report. I mean, good thing. In this holiday special, we can,
There we go. That's not part of my, that's not us. But our prescription program is really what keeps folks healthy and out of the emergency room. You can go to the doctor all you want and they can prescribe you medication, but if you can't take that medication, you're probably gonna end up back there. And so that's what we're here today to ask for continued funding. Previous to last year, from 2019 through 2024, we had received $110,000 a year in funding from the commission. Last year, we did ask for a lesser amount. We asked for $100,000 last year. We had seen a slow decrease in the need for prescription funding. Grace Med had opened their 340B program. We had a lot of patients go over there, and we just didn't have the need, and so we did not want to ask for funding that we didn't need. Once January hit, that completely flipped. We have really been looking at our funding for this year, or our spending for this year. We are largely overspent in 2025 right now as we're sitting. Looking at the data, we are we've seen a 5% increase in the number of claims for prescriptions, but we're seeing a 20% increase in the number of costs of these prescriptions. So costs overall are just going up. The largest ones that we are seeing need for is inhalers. So this is going to be if you have asthma, COPD, if you are sick and you need help recovering from something, lung-wise. And then metformin and other diabetic medications. These are largely going to be oral medications. We really don't cover insulin. We have a small insulin bridge program, and we help patients actually get on the manufacturer charity care program. But when you need insulin, you can't wait the 6 to 8 weeks that it takes sometimes to get on those charity care programs. So we have a bridge program that we will cover insulin as needed for those patients. But otherwise, it's these oral medications that have tripled in cost from 2024 to 2025. So overall costs are just increasing greatly, and that's why we're asking to go back to that funding of $110,000 per year. I don't know if you have any other questions on that. I think that kind of sums up, the reasons for our increase in the cost.
The one thing is just, I also always go back to is what was the purpose of health access? I think sometimes we forget about the purpose. It's to catch those people in between federal assistance and private pay insurance or being able to obtain insurance. So it's trying to catch those that would be using the most of the services from our ER and tying up services otherwise.
Mm-hmm. Yeah, Teresa, the patient here, is a prime example. She was with Health Access, I think, for less than 2 years. She reached 65, now she has Medicaid. She's had intense case management throughout that whole process. And I will tell you, we all celebrated big time for her when she obtained Medicare. Now she's living in her own apartment, she has income. She's just been one of our greatest success stories.
That's great. Okay, any other questions?
No.
All right, thank you.
Thank you.
Okay, next up is the Extension Office.
Good morning, Commissioners. Candace Stiles, Shawnee County Extension Director, and with me today is our Extension Council Board Chair, Sherry Scheidemann. I'm happy to present our 2026 budget request for the Shawnee County Extension Council. This request was drafted by our Budget Committee of the Extension Board, then approved by the entire board, and approved by our K-State Area Director, Carla Nemechek. Our request includes a 2.4% increase in our county appropriation. Our entire budget request is an increase of 2.51% over our 2025 budget. Our funding is a partnership between the county and K-State, and K-State is also increasing their contribution to our budget by 2.37%. The budget we're requesting is to keep our office at the same staffing level and our programs at the same level that we have today that are supported by the county. We're covering the costs that have gone up through the year, like rental, employee benefits, contract services like our copier lease, and our pest management. We have 2 line items that are increasing by more than 3%, our rent and utilities line, and our health employee benefits, which includes capers and health insurance for our staff. Our rent and utilities line is a 13.5% increase, but that's $3,000. It's going from $22,000 to $25,000. And our employee benefits line is increasing 3.5%. I also have to mention the help our office gets from our volunteers. Since our last budget hearing, they have logged over 13,906 hours, the equivalent of 6.5 full-time staff members. We couldn't offer 4-H, master gardeners, volunteer income tax assistance without our volunteer support. And we're lucky to have the support and the volunteers that we do, and we really see it as the people of Shawnee County believing in the programs and the work that we are offering to where they will even give of their own time to make those programs happen. Our agents are always looking for support of their programs and additional funding opportunities. Our in-kind donations that were listed in the budget packet amounted to $104,195. I'm happy to answer any questions you might have about our 2026 budget request.
Questions?
Are you getting impacted by the federal changes with SNAP and everything else? I mean, because SNAP was one of the programs that you guys helped educate people on.
Yes. So SNAP Ed, which was the education portion of the supplemental nutrition program, is eliminated with the bill that was passed. We have one full-time SNAP educator, and right now K-State is looking and absorbing that position within our FNEP program, which was not affected by the bill. So while those educational programs will be going away, we will still have the expanded food and nutrition programs that we still do in Shawnee County.
Okay, thank you.
Any other questions? Okay, thank you.
Thank you.
All right, next up is Vallejo.
Good morning, Commissioners. I'm Christine Wills, still the interim CEO for a few more months till our merger is complete. I just kind of want to go over a few updates, then I'll hand it off to Brian and Kathy to kind of go over budget and other information. In this last year, combined with our three organizations, we served over 13,002 unduplicated individuals and families. I want to update here because this is very exciting for us at Vallejo. We have been undergoing renovations to our current crisis center, making it it's going to be made into a crisis intervention center, going from 26 beds, crisis stabilization beds, to 30 secure care beds, which means we will be doing both involuntary and voluntary treatment. And we also will be providing, which is hopefully new to the community, we'll be doing a medical detox. We'll be able to medical detox people there as well. So, and we'll be prescribing 24/7, and that's been kind of a gap in our current crisis centers. We haven't had prescribers on outside of traditional hours. So, and then Family Service also expanded their treatment and recovery center up to 24 beds, with 8 of those being focused with youth with substance use disordered needs. Both Family Service and Vallejo have begun doing more competency work within the jail and in the community, and restoration services. At the time I submitted the report, Vallejo had done at the jail 81 competency evaluations, and our restoration work is starting very slow, but it is happening, and it's going. And then Family Service also added on-site behavioral health services and assessments within the county youth detention center. So, and then also we used this for some of the funding last year, that the increase that you gave us last year. Earlier this year, we did add an assistant outpatient treatment program, working very closely with Judge Eberts, and we got that going in March of this year. So, and again, it's small, but we're trying to grow it up. So, I will pass it off to Brian and let him.
Thanks, Chris. Morning. Yeah, still morning. So, first I want to say what an honor it is to be with you all, great civic leaders, and you guys are an amazing group of people. I'm privileged to be in the same room with you. In this last couple of years, we've had some amazing things happen at the Breakthrough House. I'm the CEO for Breakthrough House, also the hospice agency for the Lotus House, which is our clubhouse here. The Lotus House is actually has become an internationally recognized clubhouse for those that have mental health issues. Our job, of course, and we have 3 group homes and several other transitional living arrangements for people that once they come out of stabilization with Vallejo and stuff, they have to have a place to go, or when they get out of the NFMHs, they have to have a place to continue that stabilization process. We take them and move them along that line of independence. And in no small part, we're touched by almost every agency in this building, so we get a lot of help to do that. But we did take some pretty good cuts. And so we were starting to plan for these cuts. We kind of knew, could feel the political climate moving the way it was, and so we just didn't get there fast enough. I know Vallejo took about a $200,000 cut in first onset psychiatric disorders, and that program had to close down. The Family Service Guidance Center and Vallejo took a $371,000 cut and serving the uninsured, and that affects, the community in a pretty negative way. We took a total of about $820,000 in a decreased amount of funding from last year to this year, totaling about a $1.39 million cut. Now, we didn't have all those numbers, as you had pointed out. A lot of these changes took place pretty rapidly in the last week or so. And we know that the city can't come in and cover all of our needs. We're doing the very best we can to try and supplement that with a billing program that we're opening up. We have some other ideas that we're going to move forward with to try and shore up, those walls where that money goes away, but it does affect outcomes. There's a lot of uncertainty, a lot of things that we don't know. Nobody in this room wants to take a step backwards in service delivery and what we do. So we'll do our very best with what we have and what we're given. What help we get, we would certainly appreciate. We have a lot of faith in the people that are on our teams and the collaborative efforts of each one of these organizations that help us. So we're going to be hit hardest, quite frankly, and what we're looking at is we're trying to make sure that we can keep our group homes open. They just cost a lot of money. We can't keep them open and staffed 24 hours a day, without supplementing that income from those group homes. So that's our biggest concern. So anyway, I wanted to just touch on those things. I'm going to turn it over to Kathy because she's got a lot to talk about. And thank you for your time.
Kathy Mosier with Family Service and Guidance. Thank you for the opportunity to speak to you today. You're receiving an additional information because last week we got hit with more cuts. So we put this together to try to bridge and get you up to speed on information. So what do we expect to happen with this $1.39 million cut that we received? One program's already had to close, and that was the onset of a psychotic episode, and getting that started earlier so that you can stabilize sooner, quicker stabilization, less cost, efficient for everyone. The other programs that could close, given this new information, the things that are not required, so crisis beds. Just because there's not enough inpatient beds in the state of Kansas, we have tried to bridge that gap, but the crisis beds that we create are diverting about 85% of people from inpatient. They're effective, they're keeping them safe in our communities, but those would be things that we would have to reduce. And then you have the group homes and the payee program, which many of our consumers are dependent upon. So the other thing is we were the first in Kansas to launch the mental health intervention team program, where we dispatch teams into schools, and we will not be able to expand into more schools, even though the schools are requesting that help. So we had some on that list, but we were able to maintain everything we're doing currently, but we won't be able to add the additional schools that were in need this year. The CCBHC model is delivering results. I think it's important that you know that, because with that helped us get to a point where that funding helped us secure evidence-based practices, keeping us on cutting edge, the things that are getting the most proven results and outcomes for consumers. That's win-win, that's good return on investment. The state, in fact, when that was being contested in the legislature, the state deployed a national firm, polling firm, McKinsey, a very reputable firm, external, that did an evaluation on the CCBHC system of Kansas. And in that, they found that the cost increase to provide services went up 40%, but access increased 70%. So if I'm doing my math right, I believe that's a 75% return on investment. So it is a win-win. We don't want to lose those services. Our outcomes are improving across the board with lower crime rates, shorter treatment periods needed, which means less cost in order to get people healthier. It increases their physical health, as they talked about just earlier. Better school performance by 85% in keeping kids in school, reduced hospitalization. So with that, I thought you'd want some information on the merger. So the merger update is that it's going along very well. It's getting more difficult with these cuts that are coming along. This is a long-term efficiency strategy, not a short-term efficiency strategy. Mergers in healthcare, they require upfront investment before the efficiencies can be realized. So we have consensus on the merger agreement. We're very close to signing these new cuts, cause pause, providing we need to make sure the agencies our sustainability plan can hold and withstand this. So we have been doing a lot of fundraising ourselves. We've eliminated 4 positions starting in January with the merger. So that's a cost savings of $475,000. However, the increased costs for the next 18 months are much higher than that. So we are required to retain electronic medical records, each of us the ones we have, and then we have to get a new domain and consolidate a new EMR system on the new domain that is across the lifespan. In order to do that, that's maintaining 3 medical records for the next year. And then after that, we'll have everything consolidated. So that's a one-time up in cost to make the merger happen. All IT systems, HR phone, the community will be able to have one phone number to call to get help, no matter what age you are, what your issues are. Those things take a bridge system and then a consolidation system. Same with our accounting softwares, our human resource softwares, all the things that were required for audits and being able to continue to maintain. And then for compliance with leveling wages and having fair and equitable wages, there's a leveling process that has to go on in a merger, and that's underway. And we need to reduce turnover because that's far more costly than paying at market value. And as you know, the market's been going up. So the urgent need to, because of the increased traffic that we're having and need that we're having and people coming through our door, requires the expansion of a parking lot. There's been some safety issues that we need to address. We've addressed some of on the short term by only allowing parking on one side of the street so that they're not checkerboard and kids weaving in and darting out the door of the Family Service and Guidance Building. And then between the agencies, what we know is coming in terms of the folks who in a bad economy, the need goes up. So ongoing fees for the merger continue. However, so we're asking for two things, the 4% increase for the uninsured, and then to help with those costs. The state did provide help with that as well. So all the CMHCs were given a 4% increase across the board, but then the legislature directed that 1.5 across the board cut. And with us, they did it on new funding, so that hit us harder, so it was a 6% cut to both Vallejo and Family Service and Guidance. And we thought long and hard about a conservative and balanced request to make sure that we could continue to give you a return on your investment. We need county and state support to help us get through 2026. The state has agreed to help cover some of our costs now. We just learned that. I believe that was early last week. And that would be up to a third of the cost of the merger to help us do that. They know that that will produce some long-term efficiencies. What we're asking from you for those one-time costs is far under the 1/3. We are also, if I'd have known what I knew today, yesterday, we probably might have had a little different ask. However, we also are expecting ourselves to be very aggressive with grants and efficiencies and fundraising. So we're doing everything we possibly can. I just want to express finally the appreciation that I have for this county. I have worked with other county commissions. This is a very supportive county, a very due diligence, thoughtful county commission, and I appreciate working with you very much. I also appreciate your longstanding support that you've had for Vallejo and the partners that work together. And we haven't let you down so far with our return on the investment that we give you, and we know it can only get better. But something's going to have to give with what's just happened recently. So the new federal and coming through the state threats, pass-throughs, undermine the gains in meeting our community's needs, and it shifts the burden more to local government. We're trying very hard not to do that and to find other ways. One of the ways that we have found is that we, through partnership with KDADS, went to the federal government, had some meetings with them, with SAMHSA and with CMS, all under HHS, and that is where we were able to get some additional help. Federally, they very much support the merger and the efficiencies that come. They know that that will come with the merger, and that is a good sustainability plan for the CCBHC model. And so they want to see that happen, and that is where we were able to get some additional help, both federally and state, on that part. So with that, we would like to partner with you to protect the progress that we're making and to not go backwards. But most importantly, we want to see this merger go through, and we don't want any barriers at the last minute to cause that not to happen. So, thank you, and we'll open it up for questions.
Any questions?
Mr. Chair. So the initial ask was for an additional $405,000. You've notified us today that you've had $1,390,000 cut. Are you increasing your request to $1,795,000 to make up for that federal cut?
Honestly, if I could, I would. I didn't know that I was able to do that, but I would still want to keep that very conservative.
Well, you heard us talk earlier.
Yes.
With the health agency.
Yes.
About unexpected. We do need to get, and if there's going to be an amendment or an amended budget, we have a week for consideration to get it added in. That doesn't mean that we would grant it.
Yes.
again, we're looking at all of the obligations the county has, but
Yes.
with these cuts, I mean, you're talking about losing your crisis housing. I suppose it's a good thing the county's building a mental health facility, because it sounds like we're going to be full.
Yes. I would agree, Commissioner Cook, and I am also in deep respect of my peer colleagues here who also are struggling, and so I leave that in the hands of the commission to do what you see right, because I trust you.
Well, if there's going to be an amended budget, we need to get it immediately so that we can get that under consideration.
Okay. Thank you.
Thank you.
Any other questions? All right, thank you. Okay, next up's the Conservation District.
Good morning, Commissioners. John Cabus. I serve as the chair on the Shawnee County Conservation District, and I don't want to keep you the last one before lunch or your lunch break. The requirements asked, we're requesting $57,000 from the county. That's not a change. It's no variance from what we've done in the past, and we have no capital expenditures planned. So we've been at that $57,000 for quite a few years. And so the Conservation District, and most of my board's here, and so before I forget, I want to introduce them. So wave back there. Angela Dake is our vice chairman. She's in the Auburn area. Francis Kelsey is our treasurer from Silver Lake. Darrell Mallard, he's from Wakarusa. He's not able to attend today. And Wayne Lukert from the Dover area. We also have our staff, district manager Mindy Worthing in the back, and our district technician is Molly Miller. And so we kind of have a unique thing that the Conservation District does. We're a county office, but we're housed in a federal office, and we allocate state funds. And it's just an example of how we cooperate with many of the people in this room and you to provide assistance to Shawnee County. And one of the things that I did note in today's headlines is flooding in Texas. Okay, so your Conservation District can't stop a 1,000-year flood. We can't stop rain. But one of the things that we're tasked to is when it rains, we try to keep that water slowed down as it comes down. And so I know that's a tragic thing in Texas, but the Conservation District in that county, it could have been worse, because I'm sure they have practices that slowed as much as it could down. They are also going to be in a situation where they're going to need to repair all those. There's one of those in every county in the nation, and that's what we do for this county. We're slowing the water as it comes down. We're protecting the resources. And I probably won't spend a lot of time going over all duties, because I think you guys are familiar with what we do, and we appreciate your cooperation. And like I said, we've stayed at that number for several years.
Good. Questions?
Your agency was hit with a cut from the federal level to your staffing. That hasn't impacted your funding request?
So the cuts that happened, and they were some of the first ones that came down actually to the USDA, and then in the Natural Resource Conservation Service, which we're housed in that facility.
Right.
That cut was kind of a bad thing and a good thing, because one of the things that we were able to do, this is the first time as we sit here today that we've been fully staffed in years. And so when those cuts were made at the USDA, we were able to hire a person that was a technician at USDA and is now our technician. So we were very blessed to find somebody that already does the work and familiar with the county right there. And so then we were able to fill our technician position that's been open for years. And so yes, we were affected by that, and we're going to see some more things, but we're working through it. And I think just like everybody said, that we just got to work through it. And so some of that technical assistance we're able to do ourselves now.
Any other questions? No? All right.
Hey,
Thank you.
Thank you.
Okay, so that concludes this batch of presentations. So I think what we will do is recess for a while. We're supposed to, well, I take that back. Joni's here. I think since we're ahead of schedule, let's go ahead and save you the trip later on.
I will be coming back this afternoon no matter what, so whichever you would like me to do.
What do you guys think? I think she's here. Let's just go ahead and do it since we're ahead of schedule. Maybe we'll get done early this afternoon.
If she was stressed out about it, I'd make her wait, but she doesn't seem to be.
Good morning, Commissioners. Joni Thanani, Director of the Shawnee County Planning Department. As has kind of been the presentation of all the other departments, I've attempted to keep my budget flat and have seen just a few small increases. The majority of those have definitely come from benefits and salaries for our office staff. For the first time since I've been in my position, we are 100% staffed. And I say that with great pride because it has been a long time coming to have a full office, and we appreciate the work that everybody within our office has done. I do have 5 full-time staff, including myself, and then we do have an intermittent position that does remain vacant, but as you will see in my presentation, I do not intend to fund that this year because we are fully staffed at this point. Budget overview, so the increase from 25 to 26, it's staying pretty much the same in terms of the percentages. Personnel within my office makes up over 98% of my budget. Contractual services, leases, and supplies makes up the remainder of that. And so I do have a few items that I've added that have increased those just a tad bit. Main changes, again, as I mentioned in MSA 1 for salaries and benefits, we see an increase of just over $46,000. Again, I point out that I am fully staffed this year, and so that does have an effect on that. The intermittent position I elected to not fund this year, so that is a savings of $15,600 on that MSA 1, which is already reflected in my numbers. In MSA 2, I did increase $740. One thing that we have really been working on doing in our office is eliminating the storage of all of the paper that we have. We have lots and lots of paper and history of the various parcels throughout Shawnee County, and we are utilizing the county contract for shred bins on that, and we're ensuring that all of the papers have been scanned in and that they are being saved within our document management systems, and then as we are going through that, then we are shredding paper to eliminate that extra need for the storage. I also increased here $100, which I actually took from MSA 3. We used to have a car for the planning department, but that has not been in play for several years. And we had a line item in MSA 3 for gasoline, and what I did instead was transfer that up to mileage, which falls under MSA 2. I do pay mileage for the planning and zoning administrator when she goes out and does inspections when we have complaints of various properties. She does go out and do on-site inspections so that we are able to enforce upon those. And so I've increased my mileage just a little bit and taken that gasoline money. Also, memberships and licensing with a full staff and ensuring that we have proper licensing and memberships to the various planning and also legal items that we have to do on an annual basis. That has increased just a little bit. The last one is the increase of $720 on MSA 4, and as you've heard throughout a lot of the presentations with our copier, we do a lot of color copies in my office. All of the maps, all the presentations we do, anything that we print out, I would say a majority of what we print is in color, and so we have seen a little bit of an increase of cost with that. It stayed pretty close, which is good. I know that others have had a greater increase. But we also have a contract for water services within our office, and so just those small amounts of change for my budget this year. So this coming away from the budget, that actual activity that we do within the office, I wanted to touch on some of the things that we do. As you know, we handle kind of two different sectors. We do the planning and zoning, which includes rezoning, conditional use permits, plats, vacations, but then we also do building permits. So this year has stayed pretty much right on task in 2025. We've had a total of 8 cases so far this year for planning. I will point out that there were 2 new cases that were submitted that are not taken into account here. So we're currently at 10 cases for 25, whereas last year as a total we did 13. So I feel like over the last couple of years we have seen a great increase in our planning cases. My first full year as the planning director in 2023, we saw very few items, and that was actually a good thing because we were very understaffed at that point. But with the busyness of all of those planning cases, it's a good thing that we are fully staffed at this point because everybody in the office plays a part in getting those cases processed. Board of Zoning Appeals, on the other hand, we've had no cases this year. Those are items where they've maybe appealed an administrative decision that I've made, or if they're asking for a variance from our regulations. Those are the cases that get filed in that situation. And historically, we don't have very many of these cases, and that has remained the same for 2025. This year, in regards to the building permits, I broke this down into 2 different categories. The first being the total valuation that we see from permits. These numbers, what they reflect is the number of permits that we have in each of these various categories, and then the total amount of increase in valuation based on those new buildings. And so this year, as of June, we had seen a total increased valuation of $28,559,585. That's about half of what we've seen over the last couple of years, and so I would say that we're right on target for what we're doing for the year. In regards to building permits fees collected, what you'll see here is, again, I would say we're maybe a little bit above or right on target for what we've historically done. In 22, we were at nearly 170,000, whereas in the last couple of years, it's been more at the 130 to 140 range. This year, we're at 93,000 in fees collected. And what that means is when someone comes in and files for an application for a building permit, they give us a value for what it is that they're building, and then we assess a fee based on that value as a percentage basis. I've talked in the last year or so about how we need to reassess these fees. Shawnee County has not increased our building permit fees since Shawnee County Planning was created in 2003. I've done an evaluation of our building permit process, and you'll probably see me coming forward to get those updated by the end of the year. But as a part of that, I've reassessed our fees and how we're charging them. And what I've discovered is that the resolution that we have now allows us to assess a fee in a certain way, and the way we've actually been assessing the fee is different. And so I would like to just enforce what it is that we have been telling people that we should be enforcing versus how we've done it. What that means is when you come in and you apply for your building permit, we ask for you to tell us the value of the construction minus labor. Well, the resolution doesn't say minus labor. The resolution says that it should include everything, including labor. And I don't know how or why that was defined that way, but for the last 20 years, we haven't been collecting fees based on labor. And it does account for that within the resolution, and in historical building code, that's typically what the recommendation is that you assess it based on the value of the building plus labor. And so while I haven't made that change for 2025, I would say that once I bring our building permit process back to you, probably as of January 1st of 2026, we will modify that collection of the fee to include labor. And so when developers come in or a builder comes in to apply for a building permit, their fees may go up a little bit. And it's not that we're increasing the fees, we're just enforcing the resolution that we have for those fees. So revenue generated by type, as you can see here, we bring in revenue for planning cases, the Board of Zoning Appeals cases, again, for these building permit applications, which is the largest amount of money that we bring in for my office. Also fireworks stands, which we all have been blessed to hear over the last week and a half. We bring in about $12,000 a year for those stands, and then various other renewals and penalties that we have within our office. My strategic plan has changed a bit over the last couple of years. Historically, my main goal has been to get fully staffed, and as I mentioned, I'm there, so that one is no longer my priority. The next few things that I'm really prioritizing, we have been working on a building permit portal for nearly 2 years, and it is almost done. We are so excited that as of August, we will be going live, at least on the backside, for office staff, and that will encompass not only the planning department, but environmental health with the health agency, also Public Works and the weed department all have portions that will be using that permitting portal. So the public will not see it yet. We won't put it out there where people will be applying online just yet. But in our office, once we receive applications on paper, we will be inputting that to the system so that we can test it and see how it's going to work. But over the next few months, I anticipate that we will go live and we will have an online portal for people to utilize for their permits. Another thing that is going to be finalizing hopefully in the next 6 months is our solar energy regulations. As mentioned, we will also be bringing to you the building permit procedures. Those haven't been updated since 2010, and so I would like to get those updated. And then long time coming is some updates to our zoning regulations. I'm going to do it a little bit different than I had originally planned, and we'll just piecemeal it a little bit and bring topics and ideas that are very important to Shawnee County and need to be focused on versus doing a complete overhaul of the regulations as a whole. Other than that, we've got comprehensive plan review. I encourage training, continuing education, and certifications within my office to try and keep our staff up to speed with current needs. And then again, our document management and record cleanup. And our website, I find is hard to use, and so as I work with IT to try and clean that up and take out wordiness and make it easier to find tabs and for the public to find our regulations and applications, we will continue to update that as we go. Other than that, if you have any questions, I'd be happy to answer.
Any questions?
No.
The changes in your, I guess, fee collection, not changing the resolution, but in the fee collection, do you kind of have an idea of what that's going to change for your office as far as revenue?
I have no idea, honestly. I would anticipate that, so the way that we can enforce that is when a builder comes in, we don't ask for any documentation right now on what it is that the cost is. They write down a cost and we take that at face value. We have the ability to ask them to provide us with their builder's contract, whatever it is, documentation. You would assume that when someone builds a house that they're not just paying an amount for that labor and materials without having some sort of contract. We do have the ability to ask for that documentation. I anticipate that labor probably does eat up a large chunk of the cost of building a house. And so what may happen is you may have a house that someone could sell for $500,000 or $600,000, where when they come in and they tell us that the value of the materials minus labor is only $250,000, and you see this, nice 4 or 5 bedroom home, and you're thinking to yourself, really, is that only $250,000? And then they can turn around and sell it for much higher. Now, sales value and the cost are two totally different things, but I anticipate that it could increase our fees. I would say at least by a third, if not to double them.
And how are you planning on making this known to the contractors and the builders? Because as soon as you implement the change, I can anticipate all of our phones are going to be ringing.
We are going to make people mad. And again, this is something that I don't know how we got where we were at, but when I looked back at our regulation, the original regulation made it so that we could have been collecting that labor, and I'm not exactly sure how that got transcribed, and I've always enforced it the way that it had always been done. But as I researched and tried to figure out, do we do it by square footage? Do we set flat fees so that we know how much we're charging per fee? I looked at that and I was like, well, why don't we start on that by just enforcing what it is that we have out there already? We will have to, when I do my building permit procedure regulation changes, I will make it quite known at that point, because you'll have to consider those changes and I will make information known at that point. We will need to probably do some press releases. We will have to send out letters or emails or notifications to people who come into our office and build regularly, because we do have repeat applicants on a regular basis, and then, signs up on our windows. With our new permitting portal, we'll have to have probably a special note out there that indicates that it's not an increase in fees, we're not changing that, it's just you have to make sure and include that cost as a part of that calculation.
Well, ultimately, this is a cost that will be passed on to the purchaser.
Correct. And this instead, so my concept and my theory on this is that it is a cost borne by the person applying. And so instead of it being, because, my office is supported by the general fund and we bring in revenue, but that revenue doesn't support my office 100%. And so if I have to, my budget is $500 and some $1,000, and the revenue I'm bringing in is 160 or less than 200,000, the cost of my office is being borne by the taxpayers of Shawnee County. If we can increase those fees a little bit and that revenue a little bit, I can help offset some of the cost of my office by the fees that are coming in for the work that we do, for actual work that we're doing.
Well, if you generate $1.7 million, the people right behind you may want it.
I don't think we'll bring in that much.
Yeah,
That would be a substantial increase.
That would be a big surprise.
It will increase, but I don't anticipate by that much.
All right, okay, thank you.
Okay, any other questions? Okay, thank you, Joni. Appreciate your willingness to go early.
Absolutely.
Okay, we'll call that good for the morning session. So we are quite a bit ahead of schedule. Do we want to come back right at 1:30 again then? Yeah. Okay, so we will recess until 1:30.